Tuberculosis, often called TB, is a serious infectious disease that has been a major health concern for centuries. It mainly affects the lungs, causing severe respiratory issues, but it can also impact other parts of the body, such as the kidneys, spine, and brain. This makes TB a particularly dangerous and versatile pathogen. TB is caused by a bacterium called Mycobacterium tuberculosis. This bacterium is highly infectious and spreads through the air when an infected person coughs or sneezes. This disease has plagued humans for centuries, with historical records showing its presence in ancient civilizations. It was once a leading cause of death worldwide, claiming millions of lives before the advent of modern medicine. Thankfully, with modern medicine, TB is treatable and preventable. Antibiotics and vaccines have significantly reduced the mortality rate associated with this disease. However, it still poses a significant global health threat, especially in developing countries where access to healthcare is limited. Understanding TB, its causes, and how it spreads is crucial for effective prevention and treatment. Public health education and awareness campaigns play a vital role in controlling the spread of TB. Early diagnosis and proper care are essential for improving outcomes and reducing transmission. Regular screenings and prompt treatment can save lives and prevent the spread of this potentially deadly disease. There are two main types of TB infection: latent TB infection and active TB disease. Latent TB infection means a person carries the bacteria in their body, but they are not sick. They don't have symptoms and cannot spread the infection. However, the bacteria remain dormant in their system. Active TB disease occurs when the immune system cannot control the TB bacteria. People with active TB have symptoms and can spread the infection to others. Understanding the difference between latent and active TB is crucial for appropriate treatment and public health interventions. Tuberculosis spreads through the air. When a person with active TB coughs, sneezes, speaks, or sings, tiny droplets containing the bacteria are released into the air. These droplets can remain suspended in the air for several hours. People nearby can inhale these droplets and become infected. TB is not spread through casual contact, such as shaking hands or sharing food. Prolonged and close contact with an infected person is usually required for transmission to occur. While anyone can get TB, certain factors increase the risk of infection. People with weakened immune systems are more susceptible to developing active TB disease. This includes individuals with HIV, AIDS, diabetes, malnutrition, or those undergoing chemotherapy. Living or working in crowded conditions, such as homeless shelters or prisons, also increases the risk of TB transmission. Additionally, people who travel to or come from areas with high TB rates are at increased risk. Understanding the risk factors for TB can help healthcare providers identify individuals who may benefit from screening and preventive measures. Section 5. Diagnosis. Identifying the silent threat. Tuberculosis, often abbreviated as TB, is a serious infectious disease that primarily affects the lungs but can also impact other parts of the body. Identifying this silent threat early is crucial for effective treatment and prevention of its spread. Diagnosing TB involves a combination of tests. These tests are designed to detect both latent TB infection, where the bacteria remain inactive in the body, and active TB disease, where the bacteria are multiplying and causing symptoms. A skin test, also known as the Mantoux tuberculin skin test, is a common screening tool. This test involves injecting a small amount of tuberculin purified protein derivative, PPD, under the skin of the forearm. A small amount of TB protein is injected under the skin, and the reaction is observed after a few days. If the area where the protein was injected becomes hard and swollen, it may indicate a TB infection. A blood test, called an interferon gamma release assay, or IgRA, can also detect TB infection. This test is particularly useful for people who have received the BCG vaccine, as it does not cause a false positive result. This test measures the immune system's response to TB bacteria. It involves taking a blood sample and analyzing it in a laboratory to see if the immune cells produce interferon gamma in response to TB antigens. If a skin or blood test is positive, further tests, such as a chest X-ray and sputum culture, are needed to confirm active TB disease. A chest X-ray can reveal abnormalities in the lungs that are indicative of TB, while a sputum culture involves analyzing mucus from the lungs to detect the presence of TB bacteria. These additional tests help healthcare providers determine the extent of the infection and the most appropriate treatment plan. Section 6. Prevention. Protecting yourself and others. Preventing TB involves a multi-pronged approach. Vaccination with the BCG or Bacillus calmette-guerin vaccine is recommended for infants in countries with a high TB burden. However, the BCG vaccine's effectiveness in preventing TB in adults is limited. Early diagnosis and treatment of active TB cases are crucial for interrupting transmission. People with active TB should take all prescribed medications and follow infection control measures to prevent spreading the bacteria. Improving living conditions, reducing overcrowding, and ensuring adequate ventilation can also help reduce the risk of TB transmission. Section 7. Treatment, a journey to recovery. This section delves into the comprehensive process of treating tuberculosis, a journey that requires dedication, patience, and a collaborative effort between the patient and healthcare providers. Treating tuberculosis requires a long course of antibiotics, typically lasting several months. The treatment is not just about taking pills. It involves a structured regimen that must be followed meticulously to ensure the bacteria are completely eradicated from the body. The exact regimen depends on the type of TB, the patient's age and health status, and the presence of drug resistance. Each patient's treatment plan is tailored to their specific needs, taking into account various factors that could influence the effectiveness of the medication. Adherence to the prescribed medication regimen is crucial for successful treatment and preventing the development of drug-resistant TB. Missing doses or not completing the treatment can lead to serious complications, making the disease harder to treat and increasing the risk of spreading it to others. Directly observed therapy, where a healthcare worker directly observes the patient taking their medication, is often recommended to ensure adherence. This method provides support and encouragement to the patient, helping them stay on track with their treatment. With proper treatment, most people with TB can make a full recovery. The journey to recovery is challenging, but the end result is a return to health and normalcy, allowing patients to resume their daily lives without the burden of the disease. However, TB can have long-term health consequences, especially if treatment is delayed or incomplete. It is essential to address these concerns early on and provide continuous support to patients even after the treatment is completed, ensuring they can lead a healthy and fulfilling life post-recovery. Section 8. Public health measures. Combating a global threat. Tuberculosis is a global health problem, and controlling its spread requires coordinated public health efforts. National TB programs play a vital role in implementing TB control strategies, such as case finding, contact tracing, and providing treatment and support services. International collaboration is also essential for sharing best practices, providing technical assistance, and supporting TB research and development. The World Health Organization sets global TB targets and provides guidance to countries on TB control. Section 9. The future of tuberculosis control. Despite significant progress in TB control, challenges remain. The emergence of drug-resistant TB poses a significant threat to global TB control efforts. New diagnostic tools, shorter and more effective treatment regimens, and an effective TB vaccine are urgently needed. Research is ongoing to develop new TB drugs, vaccines, and diagnostic tests. Advances in molecular diagnostics are improving the speed and accuracy of TB diagnosis. Innovative approaches, such as the use of digital technologies for TB surveillance and contact tracing, are also being explored. Section 10. Conclusion, a call to action. Tuberculosis remains a major global health challenge, but it is a preventable and treatable disease. Understanding the causes, symptoms, and prevention measures is crucial for controlling its spread. Early diagnosis, prompt treatment, and sustained public health interventions are essential for reducing the burden of TB worldwide. By working together, we can strive for a world free from tuberculosis.